Case number 1, scenario: a 60-year-old white man came to your office with the complaint of appearance of dark lesion in posterior part of the oral cavity that doubled in size within a month. History revealed that the patient underwent treatment for skin cancer. On examination, you found asymmetric of the size of 3 cm by 1.5 cm, brownish black patch interspersed with grey coloration with irregular, well-defined border and smooth surface. It was rough to touch, unscrapable, non-tender on palpation in buccal, alveolar gingiva and palatal mucosa, associated with right first and second maxillary molar teeth along with second premolar. This is the clinical photograph of the patient, second premolar tooth. Photograph number A, you are looking at the black brownish patch on the buccal side and on the palatal side of the right side of the maxillary jaw. In photograph B, you can see the brown black patch in the buccal mucosa associated with first molar and second molar. In photograph C, you can see the patch which is starting from the second premolar and going upward, making a circle and coming down up to the distal part of the second molar. So this whole area is patchy. It is associated with second premolar, first molar and second molar. Note down that the patient has a history of skin cancer treatment. Now the question comes, question number 1, based on the information available, what may be the differential diagnosis? Option A is melanotic macule, which is a benign discoloration. Metastatic melanoma, it is the malignant form of melanoma. Drug-induced melanosis, because patient had history of treatment for skin cancer. So it may be caused by drugs also, or it may be a melanocytic nevus, or differential diagnosis may be all of the options given. So the answer will be E. So you can tick the answer E. Scenario based question number 2. What investigations you will requisition for the confirmation of the diagnosis? Histopathology, of course. Immunohistochemistry, of course. OPG and CT to see the condition of the jaw, bones and associated structure with teeth, of course. MRI, definitely we will go for this. So all the investigation we will do, we will send requisition for all the options. So answer will be E again here. Now the results have come up. Scenario based question number 3 is, what are the findings of OPG or findings of the OPG? Option A is the haziness in the right maxillary antrum. So this is the antrum up to here. This is the orbit. So it is not very clear. So of course haziness is there. Obliteration of antral floor from here to here. You can see it's not very clear. The floor is also not very clear. So obliteration, we can say it is obliterated. The radiolucent part we can see here, although it is here also. So we can say it is obliterated. Okay. Option C is periapical radiolucency with first molar and second molar teeth. This is the second molar, and surrounding second molar I can see the bone up to here. In periapical area I don't see any radiolucency, and as much as I can see with 1/6 there is no radiolucency except this one, but it's not very clear. It may be floor of the mouth haziness, so this option is discarded. Option D is the option A and B. We have already selected it. Option A is option B and C. So C is not the correct answer. So we will tick for D. The correct answer will be D. So based question number 4 is the findings of the contrast enhanced CT are A. Focal nodular enhancing soft tissue lesion in the right palate. Okay, this whole area is the right palate. Basically this is the palate. I am sorry, this is the palate. Soft tissue lesion in the palate. Soft tissue lesion we are looking here. These are the soft tissues. White CT scan, no, these are the bony area, these are the soft tissues. This one is the soft tissue. So okay, we chose this one. Focal nodular enhancing soft tissue lesion, gingival sulcus. Okay, this is the gingival sulcus here. We can say soft tissue here also. So okay, we selected this answer also. Focal nodular enhancing soft tissue lesion involving inner alveolar process of maxillary molars. Inner alveolar process of the maxillary molars. This area. Okay. So we chose this one also. Thickening of maxillary antral lining mucosa. We can see that this sinus is filled with these tissue areas. So okay, thickening is also, and soft tissue is there in the maxillary antrum. On the opposite side we are not seeing anything here. So answer will be E, all of the above. Scenario based question number 5 is the asking for findings of the MRI. Findings are number A1. Option A is this is an axial section of the head region. Of course it is the axial section or transverse section of the head region, so this is the correct answer. Option B is the focal nodular hyperintensity mass in the alveolar process of the maxillary molar. Hyperintensity mass. Okay, this is the molar area. 1, 2, 3, 4, 5 premolar area. This is the molar area. Okay. So we are looking at the mass here also. Correct. Thickening of maxillary antral lining mucosa. This is the sinus. So thickening of the maxillary antral lining mucosa, we can see this one. It is also there. Option A, B, C are correct. Okay, 3 are correct. A and B are correct. No, we will choose for option D. Now the results of the histopathology and immunohistochemical markers. The these are the A and B. Where is the marker, man? Okay, here. This is the photograph A and this is the photograph B of histopathological staining. H and E, hematoxylin and eosine. We are looking at the hyperchromatism. Hyperchromatism and nuclear pleomorphism in the junction of epithelium. So by arrow, this area is showing hyperchromatism. Here also chromatin. Hyperchromatism means chromatin material is more produced in malignancy. Chromatin material is produced in abundance. And in this picture also you are looking at the chromatin material here by eosine, which is giving blue color, magenta color here. This one is also. So it is sign of malignancy. Immunohistochemical markers are there for S100 and HMB45. So this one area is giving a dark color to the melanocytes. This one is also, and note that they are irregular in shape and size. So they are showing sign of pleomorphism along with very polymorphism also. So both these investigations are considered confirmatory for the diagnosis of metastatic melanoma. Question number 6, based on scenario, what is the final diagnosis of the disease based on the signs, symptoms and findings of the investigation? Hemangiosarcoma? No. Metastatic melanoma, of course, by histopathology and immunohistochemical pathology, immunohistochemistry we saw in the previous slide. Nevus, it is a benign thing, so we saw sign of malignancy. Varicose carcinoma, we did not see the veins. Squamous cell carcinoma, we did not see the epithelial pearls, so answer will be B. You have to analyze your question the way I am describing here in actual example. Scenario based question number 7 is, what treatment plan you will suggest for this case? Option A is immunotherapy. Okay, we will give it to the patient. Targeted cell therapy to kill the cancer cells. Radical resections to surgically remove the growth. So all of the above and none of the above. So answer will be option D. Please note down that there are other treatment also, like gene therapy and chemotherapy, but these things are not given in the options. So I'm telling you just for your information. This is the end of this presentation of scenario based questions and answer. I, Dr. Ajay Mohan Singh, thank you for paying your attention, and you can join our academy for ADC part 1 and part 2 examination. If you have passed part 1, so you can join us also for preparation of part 2. And we also train dentists for overseas registration examination to get registration in General Dental Council of the United Kingdom. If you want to immigrate to United Kingdom, do join us or write to us. Thank you very much again.